Okay, so now we'll talk about the mechanisms of preterm labor. And it can actually be triggered by several different ways. So stress is going to be a major one, and the way that that is going to trigger preterm labor is basically just by prematurely activating the normal process of how we progress to labor. And so by activating the maternal fetal HPA axis, it's going to increase CRH production, increase the estrogen progesterone, or estrogen and actually prostaglandin production. You're going to have this decline in progesterone action. If you have cervical disease, then that is going to allow that dilation a little bit earlier. If you have uterine overdistension, that is going to activate the oxytocin positive feedback mechanism. And then the other causes are going to really be related to the inflammatory cytokines and prostaglandins that are going to break the water or separate the placenta from the wall of the uterus or ripen the cervix. Okay, going through this one more time. So maternal stress is going to increase cortisol, which that is going to trigger the release of CRH at the placenta. CRH is going to activate both the fetal and maternal, actually, HPA axis. So you're going to have this positive feedback right here. And you're going to activate the fetal HPA axis, which is going to stimulate the release of cortisol and then so on. But also remember, we're going to release androgens or the DHEAS. Those androgens are going to be turned into estrogen in the placenta and then released into maternal circulation. And so estrogen is going to increase the oxytocin receptors in the uterus. It's going to increase the gap junctions and a couple of other things. Also, once we have this system going, once we increase CRH, we are also going to increase prostaglandin production. Prostaglandins are going to act similarly to estrogen in priming that uterus and getting it ready to respond to oxytocin, and that is going to lead to contractions. Prostaglandin also induces cervical change and then also stimulates an inflammatory process at the to cause the rupture of membranes. And so you can see that if there is a lot of stress and you have a lot of cortisol, then you're going to have a stronger feedback system that is going to quickly or more quickly increase the CRH. And you're going to be at risk for preterm birth. So this is just another way to look at it for preterm people who have preterm births. This elevates the CRH production, elevates a little quicker. For people who have post-term births, it does it a little bit slower. And so just so you know, post-term does not mean better. Actually, it's very dangerous to go past 41 weeks of pregnancy. But also preterm is dangerous too, right? Because that's one of our leading causes of infant mortality. And so there's other mechanisms like we discussed. So we talked about the activation of your HPA axis. This is talking about the placenta, basically. Inflammation, and this inflammation could be due to sickness like COVID, or it could be due to STDs, or it could be due to other inflammatory processes. But if that gets triggered and you have all of these cytokines, that's also going to impact at the level of the placenta and the amniotic sac. You could also have a hemorrhage or an abruption. That's basically where the placenta tears away from the uterine wall. It can be very dangerous depending on how bad it is, or it could have, be little points of, abruption. And so this is going to kind of stimulate that whole process too. And then you could have the pathologic uterine distension, and that's going to be from twins or triplets. That's why preterm labor is very related to multiple gestations. And so that is going to stimulate contraction. So uterotonins, that's the hormones basically that stimulate contraction. It's also going to stimulate enzymes that cause cervical change and rupture membranes. And then you have this positive feedback again. And then that leads to preterm labor. So the other piece of this, we talked about the HPA axis and cortisol and the role of that. But, if maternal stress is triggered, we also have to talk about catecholamines. And so that's your norepinephrine, your adrenaline, that is going to decrease placental flow and stimulate CRH production. So now you have another feedback mechanism that stimulates placental CRH production, not just the cortisol, but also the catecholamines. And then, of course, we're going to have this trigger more cortisol release. And so this norepinephrine, it's going to cause vasoconstriction, as you know, because that's what it does. The whole placenta is basically a bunch of blood vessels. So that vasoconstriction is also going to increase the uterine contractility and increase placental production of CRH. At the same time, on the fetal side, catecholamines and cortisol both stimulate fetal development. And that makes sense because these are, expected to rise at the end of a term pregnancy. But if we stimulate them earlier, then they are going to act on the fetus earlier. And so one of the things that they do is increase lung development. And so you have an increase in surfactant synthesis and an increase in surfactant release. And that actually, as the lungs mature in developing fetuses, has another feedback, another positive feedback that stimulates both uterus contractions and rupture of membranes, or, when the water breaks. And so now you have yet another mechanism that helps with all this. And then this is showing a twin pregnancy, which would be expected to increase the stretch receptors, which stimulate oxytocin release and everything else that we talked about, which also feedback. So at this point, you should be able to understand why any kind of maternal stress, also fetal stress, but any kind of maternal stress is going to both increase the placental CRH, which stimulates fetal HPA axis, but also increase contractility, increase inflammation. And then we should have like another little arrow there, and increase preterm birth.